Well, yeah, it was, it was, it had not been strong.
Mr. Williams?
Whoa.
John Williams? You come up a moment? Good morning, everyone, and welcome to the House Committee on Health, Human Services, and Elderly Affairs. As noticed, we are going to be in executive session today considering 14 bills that have come over from the Senate. Before we get to those, however, I'd ask you to please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. Okay, we're going to go a little bit out of order to start off with. We are going to start with SB 138 and Representative McLean. I believe you have a motion.
Actually, I have an amendment.
Oh, I'm sorry.
Yes.
Representative Mazur, you're recognized for an amendment.
Yes, thank you, Mr. Chair. I move to amend to OTP on amendment number 1764H.
And I will second that motion. You're
And-
recognized to speak to your motion.
Yes, this amendment, you can see how short it is. It simply removes the establishment of the committee in the bill. So it also changes the title. So the title made reference to establishing the committee, which has been removed, as well as the entire section 2 referred to that committee, which also has been removed. So that's it. Easy amendment.
Sure. Is there any other discussion on this amendment? Anyone? Okay, if there's no discussion, then I will ask the clerk to call the roll. The motion is ought to pass, and I believe the amendment number is 1764H.
Yep.
Correct.
Okay, Mr. Clark.
Rep. Mazur,
Yes.
Rep. McLean,
Yes.
Rep. DeLamus,
Yep.
Rep. Guyson,
Yes.
Rep. Polzov,
Yes.
clerk votes yes. Rep. Korzen,
Yes.
Rep. McGrath,
Yes.
Rep. Kesselring,
Yes.
Rep. Weber,
Yes.
Rep. McKay,
Yes.
Rep. Woods,
Yes.
Rep. Tejas,
Yes.
Rep. LaMontagne,
Yes.
Rep. Hartnett,
Yes.
Rep. Lucas,
Yes.
Rep. McDonald.
Yes.
Vote is 17-0, motion passes.
Okay, thank you. Representative McLean, I believe you have a motion?
Yes, Mr. Chair, I'll vote, move ought to pass.
Is amended?
As amended, correct. Yeah.
And Representative Mazur?
Second.
Representative McLean, do you wish to speak to your motion?
Yeah, thank you, Mr. Chair. So I think the only thing that this does really is, it's already recognized that the patient owns their records and that they're going to have access to the records. This just establishes the fact that those records are going to be provided within 14 days of the request, which even a letter that we had from the Hospital Association says that's something that's already being done. So this is just, I think, codifying current practice.
Okay, thank you. Any other discussion? Representative Drew?
My objection to this is simply that it is a specification of not only price, but also time, which is something that I'm always very reluctant to do when it comes to any market, and especially something that never gets adjusted over time. So at some point, we may run into a problem where the people who are providing these services can no longer provide them at the cost that's specified in the law. So I'm going to be voting against this.
Okay, thank you. Anyone else? Seeing no one, I'll ask the clerk to call the roll. Motion is ought to pass as amended on SB 138.
Rep. Mazur,
Yes.
Rep. McLean,
Yes.
Rep. DeLamus, Rep. Guyson,
Yes.
Rep. Polzov,
Yes.
clerk votes no. Rep. Korzen,
Yes.
Rep. McGrath,
Yes.
Rep. Kesselring,
Yes.
Rep. Weber,
Yes.
Rep. McKay,
Yes.
Rep. Woods,
Yes.
Rep. Tejas?
Yes.
Rep. Lamontagne? Rep. Hartnett? Rep. Lucas?
Yes.
Rep. McDonald?
Yes.
Vote is 16-1, motion passes.
Okay, is there any objection to consent? Okay. All right, we'll put that on the consent calendar then.
Who's doing the report?
And Representative McLean, you'll do the report on that? And as Representative Mazur reminded me, at the chairman, vice chairman's meeting yesterday, it was requested, actually dictated, I think, we were directed to please, in any committee reports we write that have been amended, where the bill was amended, to please start off by addressing the amendment, what it did in the committee report. So if you could please do that, and if anyone writing a committee report of a bill that was amended, if you could do that, it'd be much appreciated. A couple of other housekeeping things before we go on to the next bill. Tomorrow is expected to be a relatively brief House session, probably get done early afternoon. A number of committees are going to be executing bills afterwards. And we're not expecting to be one of those committees, but they are going to be holding the calendar open for those reports. So if we can get any of the reports from today in, no pressure. I mean, if we can't, we can't, but we're not required to, or well ahead of schedule. But the more we have that we can get in, the more we can consider at the next House session. So anyway, I'll just throw that out. And again, what we can do, we can try to do. One final note, and this is totally unrelated to executive session, but it is a housekeeping item. The move to Granite Place is in process. If anybody has any personal belongings and here in the LOB, please bring them home, put them in your car, do whatever you're going to do with them. Because they're starting to move stuff on May 22nd, and these things are going to be in danger, I guess. So and I don't know that applies to anyone here. It doesn't apply to me, but it does apply to some folks. So anyway, moving on. The next bill I'd like to move on to is SB 257, and Representative Drew, I believe you have a motion on that one.
Thank you, Mr. Chair. I move to ITL this bill.
Okay, and Representative Mazur.
Second.
Okay, Representative Drew, do you wish to speak to your motion?
My opposition to this is simple. This is yet another commission and committee. We tend to establish these all the time. Sometimes they do something, sometimes they don't. Most often they don't. I don't really see a need for this, and so I'm opposing it.
Okay, thank you. Representative Weber.
I think it's actually, if the sentiment had been different, I had an amendment that would have removed the extra commission in there. I think the underlying bill is worth studying, so I will be voting against the IDL.
Okay.
But I won't be submitting the amendment or anything. It will just be a straight vote.
Sure. Okay. Thank you, Representative Weber. Anyone else? Seeing no one? Okay, Mr. Clerk, when you're ready, please call the roll.
Rep. Mazur?
Yes.
Rep. McLean?
Yes.
Rep. DeLamus?
Yes.
Rep. Geisen?
Yes.
Rep. Polzov?
Yes.
Clerk votes yes. Rep. Korzen?
Yes.
Rep. McGrath?
Yes.
Rep. Kesselring?
Yes.
Rep. Weber?
No.
Rep. McKay?
No.
Rep. Woods?
No.
Rep. Tejas?
No.
Rep. Lamontagne?
No.
Rep. Hartnett?
No.
Rep. Lucas?
No.
There's Rep. Siebert? SB 257?
Wasn't here when the question was put.
Was, okay.
No.
Can't vote.
Yeah, sorry. Rep. McDonald?
Yes.
Vote is 10-7. Motion passes.
And I'll write a minority report.
Okay. Thank you. And Right. Representative Webb. Representative Webber, we're all set. You know, everybody's here.
Yes, we're all set.
Right.
Thank you. And thank you very much for the accommodation. I appreciate
Okay.
it.
All right, moving along, the next bill to be considered this morning is SB 36, and I recognize Representative Kesselring.
I move to retain.
Okay, and Representative Mazur?
Second.
Representative Kesselring, do you wish to speak to your motion?
Yes, I would. So the underlying bill has a lot of things that we would like to discuss and work out and try to fix. We like the intent of the bill, but we'd like to bring it back with some additions or some amendments.
Thank you. Representative Weber.
I'm not sure that retention is going to help, so I'm going to vote, having seen this bill in many iterations many times, I'm going to vote against the retention, but I can count, so.
Okay. All right, thank you. Anyone else? Representative Polazov.
I support motion to retain, and there are several reasons to retain, but one additional reason, and that we heard from department that the chapter reference is not correct in this bill, and I was trying to fix it, but the amendment draft was not successful, so that's yet another reason to retain and work on the bill.
Okay, thank you. Anyone else? Seeing no one, I'll ask the clerk to call the roll. Motion is to retain Senate Bill 36.
Rep. Mazur,
Yes.
Rep. McLean,
Yes.
Rep. DeLamus, Rep. Guyson,
Yes.
Rep. Polizov,
Yes.
clerk votes yes. Rep. Corzine,
Yes.
Rep. McGrath,
Yes.
Rep. Kesselring,
Yes.
Rep. Weber,
No.
Rep. McKay,
No.
Rep. Woods, Rep. Siebert,
No.
Rep. Tejas,
No.
Rep. Lamontagne,
No.
Rep. Hartnett, Rep. Lucas,
No.
Rep. McDonald.
Yes.
Vote is 10-8, motion passes.
Okay, and no report will be not needed for that. We will need to revisit that in time for the November deadline for retained bills. Next up is Senate Bill 37, Representative Drew.
I move to ITL SB 37.
And Representative Kesselring. Representative Kesselring seconds. Representative Drew, do you wish to speak to your motion?
Yes, 1 second.
When you're ready. Juggling a lot of duties this morning.
So I haven't done a complete full dive on this, but my investigation to this revealed that this essentially takes what is a voluntary QA program for residential care facilities, makes it mandatory, and then applies it to everything licensed under RSA 151.2, which is an extraordinary expansion of state power. And it's also done without any kind of fiscal note or any funding to expand this inspection program. So I don't see this as a workable bill, hence the motion to ITL.
Okay, thank you. Anyone else? Representative Weber.
Well, basically, if I look at the language of the bill, all it's doing is requiring that work that is already done. And this, we are talking about safety information for our most vulnerable people. And so I think that ITLing the bill is very, is short-sighted. And I think that we do a disservice to the folks who are either looking to live in these institutions or family members who are searching for the best place if we don't give them as much possible about, information as possible about safety. So I think it's very inadvisable to ITL the bill.
Okay, thank you. Anyone else? Representative Lamontagne.
Yes, I just want to agree with Rep. Weber and also point out we are an aging state, and this is going to be ever more a part of our future care for the elderly and and people with dementia. And asking for another 4 hours of continuing education a year is not a big stretch for anyone working in these facilities. So I am also going to vote against ITL.
Thank you. Anyone else? Representative Hartnett.
Thank you. Yes, I'll be voting no as well. And briefly, just think YDC.
Thank you. Anyone else? Representative McLean.
Yeah, I think the intent of the bill is good, but I just think the scope is because it's going after everything, as Representative Drew said, in RSA 151:2(1). So that's a massive expanse. That's everything. That's birthing centers, dialysis centers. That's across the board. So if it was more narrow in scope, I would support it. This is just too broad to come in and just pass like this. Thank you, Mr. Chair.
Thank you. Representative Woods.
Thank you, Mr. Chair. As far as the broad, I think it reflects the current status of medicine. It used to be you went to a facility, a hospital, and now you have, as was outlined, we have an ancillary for good purpose and for good medicine. We do have ancillary services, dialysis, infusion centers, but I think by the same token, we should keep them to the same standard that we have at the original facilities. And we have no trouble incorporating that in terms of what a facility, we've been, just a few sessions ago, we further outlined what a facility should look like in terms of their responsibility and posting it and so forth. I think this just makes it fair across the board and reflects medicine and the way medicine is practiced today, and for the purposes of making sure that we're doing the correct thing for patients, which is really what medicine's about. It's not about, making it easier for the facility. It's making sure that the patients are protected and have confidence. Right now, we have a little bit of a problem with having patients feel perfectly confident with medicine, with the corporatization process. I think this reflects those changes, and therefore I will vote accordingly.
Thank you. Anyone else? Saying no one else, okay. I'll ask the clerk to call the roll. The motion is ITL on Senate Bill 37.
Rep. Mazer?
Yes.
Rep. McLean?
Yes.
Rep. Delamus?
Yes.
Rep. Guyson? Yes. Rep. Polzov?
Yes.
Clerk votes yes. Rep. Corzine?
Yes.
Rep. McGrath?
Yes.
Rep. Kesselring?
Yes.
Rep. Weber?
No?
Rep. McKay?
No.
Rep. Woods?
No.
Rep. Siebert?
Yes. Or wait, no,
No.
sorry.
Rep. Tejas?
No.
Rep. Lamontagne?
No.
Rep. Hartnett?
No.
Rep. Lucas?
No.
Vote is 10-8. Vote Chairman McDonald.
Yes.
Vote is 10-8. Motion passes. Someday I'll be good at this.
No? Yeah, fine.
Minority report. Jess or Gary, do you want to do a minority report? Somebody?
Representative Wood?
Thank you. Appreciate it.
Yep, thank you. Okay, next up is Senate Bill 92. Representative McLean.
Thank you, Mr. Chair. I'll move ought to pass on SB 92.
Okay, and Representative Delamus? Representative Delamus seconds. Representative McLean, do you wish to speak to your motion?
Yeah, thank you, Mr. Chair. So this bill just starts to build upon the constitutional amendment that we had, 6 or 7 years ago, And it puts some very modest privacy provisions on the type of information that is provided to the CDC from the birth record, so that it ensures that that record is anonymized, so the CDC can still use the data in its aggregate form, but trying not to tie it back to the individual. So I think, this is a reasonable step forward, and I'm supporting the bill. Thank you, Mr. Chair.
Thank you. Anyone else?
Do we?
Okay, seeing no one? I'll ask the clerk to call the roll. Motion is
what-
not to pass on Senate Bill 92.
Did-
I'm sorry.
I'm just looking around, seeing if anybody wants to talk about that, but
Okay,
apparently
got
not.
Okay. I had looked around, I didn't see him.
You're quite right.
Mr. Clerk, please call the roll. Senate Bill 92, motion is out to pass.
Rep. Mazer,
Yes.
Rep. McLean,
Yes.
Rep. Delamus. Yes. Rep. Geisen,
Yes.
Rep. Polzov,
Yes.
clerk votes yes. Rep. Korzen,
Yes.
Rep. McGrath,
Yes.
Rep. Kesselring,
Yes.
Rep. Weber,
Yes.
Rep. McKay,
Oh.
Rep. Woods,
Yes.
Rep. Siebert,
Yes.
Rep. Tejas,
Yes.
Rep. Lamontagne,
Yes.
Rep. Hartnett,
Yes.
Rep. Lucas,
Yes.
and Rep. McDonald.
Yes.
Vote is 17-1, motion passes.
Is there any objection to consent?
It's is there an appropriation on it?
It's not an early bill. It shouldn't be a problem.
No.
Okay, next up is Senate Bill 118, which is an early bill. And Representative Polazov, you have an amendment to that.
Yeah, I move amendment 2025-1755H to Senate Bill 118 FN. And
This has
this,
been distributed, correct, Representative?
yes.
So you should have a copy. Does anyone need some time to read
It
it?
it was 155,
1755.
1755. Yeah, okay. Thank you. So can I just inquire?
Representative Weber.
So, as I understand it, what this is doing is adding cannabis cultivation. Was there anything that was removed from the original bill, or it's just tacking a different bill onto it?
Yeah, just attaching House position as passed in House Bill 53.
And just to close the loop, Representative Wu, you second?
I second.
Okay.
Yeah,
Okay, Representative Weber, or?
Well,
as I started explaining, this amendment just attaches House position as we passed as in House Bill 53, and at least half of the other body was in support of our position. So there are just some minor problem with them. And as we heard during testimonies, the underlying Senate Bill 118 requires some financial input. We heard from New Hampshire Municipal Association that there's some tax paying associated with the underlying bill, and attaching House position on homegrown helps alleviate at least some of this tax pressure, because we know that if some patients will have to pay more county taxes or otherwise, ability to grow their own medicine can at least alleviate it a little bit. And that's the reason for this amendment.
Thank you, Representative. Representative Weber?
Thank you. I'm now confused because you're stating your concerns about the underlying bill, but I thought that what you had said was that the underlying bill is unchanged. We're just adding this to the underlying bill. Is that correct?
Yeah, that's correct. I'm saying that there were raised concerns that underlying bill increases taxes, so it will be more expensive for our constituents. So I'm adding a house position on therapeutic cannabis ability for patients to grow them and save money that way to balance, but I'm not changing the underlying Senate Bill 118.
Thank you for the explanation. And now I have a comment.
Okay, sure, go ahead.
Thank you very much. I just want to say that I am very much opposed to muddying up issues by tacking bills to each other. We have every right to do so. It's very appropriate. And it's certainly a bill that I voted for when it went through the House. So my personal decision on this, and it would be helpful if we'd heard these things earlier, was my personal position is I'm going to vote against the amendment. That having been said, if the amendment's successful, I'm not going to vote against the underlying bill because I think the underlying bill is very important.
Okay, anyone else? Seeing no one, okay. Motion is ought to pass on this amendment, 1755H, and I'll ask the clerk to call the roll.
Rep. Mazer,
Yes.
Rep. McLean,
Yes.
Rep. Delamus,
Yes.
Rep. Geisen, yes, Rep. Polizov,
Yes.
clerk votes yes, Rep. Korzen,
Yes.
Rep. McGrath,
Yes.
Rep. Kesselring,
Yes.
Rep. Weber,
No.
Rep. McKay, Rep. Woods,
No.
Rep. Siebert,
No.
Rep. Tellez,
No.
Rep. LaMontagne,
No.
Rep. Hartnett,
No.
Rep. Lucas,
No.
Rep. McDonald.
Yes.
Vote is 10-8, motion passes.
Okay, thank you. And I have to apologize to the committee and particularly to my caucus. I had forgotten about this other amendment. And if anyone needs a caucus, please let me know. But before we decide if we need one, I'd like to ask Mr. Williams, just to explain the amendment. I was asked to introduce this, and again, there's been such a flurry of activity, it slipped my mind until this morning. So, again, my apologies. Okay, go ahead, proceed. There you go. Microphone is on.
Good morning, Mr. Chairman, members of the committee. My name is Nathan White. I'm the Chief Financial Officer with the Department of Health and Human Services. We came here a couple of weeks ago and we discussed SB 118. We did at that time identify a few potential technical issues. The amendment before you, 2025-1682H, this is an amendment that modifies some of the language around the dedicated account that was being established for new lease revenue. Part of a very brief history here is the department entered into an agreement with Final Closure in February of this year with Dartmouth Health, whereby Dartmouth Health is now leasing Hampstead Hospital that was previously operated by the Department of Health and Human Services. Under that new agreement, there is lease revenue now coming in this state fiscal year. So two of the major changes included in this amendment are Section 4, which allows the department to transfer some of the lease revenue from the current state fiscal year into that dedicated account, and then the effective date sections for sections 3, 4, and 5, which would be June 30th of 2025. What that does is it allows that revenue not to otherwise lapse, and it allows that revenue to be transferred into the dedicated fund. The reason that we were asking for this dedicated fund is we have a unique circumstance whereby under the terms of the new lease agreement, it's a 7-year lease agreement with Mary Hitchcock Memorial Hospital, whereby the state is obligated to match dollar for dollar capital expenses in the facility up to an amount of $3 million. So it is very unique. I'm the former contracts director. I've never seen an agreement quite like this. And as a result of that, when it comes to budgeting, it's a little tricky because we don't necessarily know when Mary Hitchcock is going to be making those investments into the facility, and the dedicated account would set aside that lease revenue and allow us to respond timely and meet our legal obligations.
Thank you. Do any committee members have questions on the amendment or of these folks? Sure, Representative McLean and then Representative Palazzo.
Yeah, so we took testimony a couple weeks back in this, and I'm looking at my notes. Could you remind us what the mission is of the Hampstead Hospital? As I recall, they were filling a unique slot within the state that nobody else is filling, and I couldn't find that in my notes. So could you refresh us on that?
Good morning, Marissa Henn, Deputy Commissioner, DHHS. Thank you for the question, Representative McLean. So Hampstead Hospital is the state's sole psychiatric inpatient hospital for young people. It also is home to a psychiatric residential treatment facility, which is like a step down for youth who don't necessarily need hospital level of care, but are not yet ready to return to their home communities. And yes, as Director White or CFO White said, we purchased the hospital, and now we're in a unique public-private partnership with Dartmouth Health. This, in many ways, really fulfills the potential of that mission, which is to provide the highest quality mental health treatment and to help kids get back into their homes and communities and live more stable and productive lives. But it also helps maximize the potential of this partnership such that it's not just the state investing in that facility, it's Dartmouth Health being able to match the capital expenses, whether it's replacing the roof or the boiler, both of which desperately need replacing. It's not just the state. Dartmouth Health has made a commitment not only to the patients, but to the upgrading and modernization of that facility.
Thank you, Mr. Chair. Maybe it's a question to Chair. As we establish this fund, will this bill be reviewed by Finance Committee, or are we the final one?
I would just point out that any appropriations were in the original bill, and then, but it was revenue that's under this contract, if I'm understanding it. It's not general funds. And what this fund that we're creating is we're just creating a line item and a holding place so that when monies come from Hitchcock or Dartmouth Medical or whichever you've contracted with, it gets held in a separate account and used for the purposes for which it was intended. So we're not appropriating new monies of any sort. We're just holding things in a clearly designated way so that we can fulfill obligations we're already contracted for. Is that correct?
Yes, and the timing is the challenge because we closed in February of this year, and as a result of that, it wasn't incorporated into the agency's budget back in August.
Gotcha. Thank you.
Okay, Representative Kesselring.
Thank you, Mr. Chair. Thank you for taking my question. So I'm looking at the $3 million total. When does the department expect that account would exceed that number?
So we would expect that account would exceed that number probably in mid to late 2027. If the amendment were passed as is, that would allow us to deposit the $631,000 from the asset purchase agreement that was entered into and approved by GNC back in December, as well as lease revenue from this year. Annual lease amounts are approximately about $1.15 million with a 3% elevator each year. So we would likely meet that next year, depending on the timing of the invoicing, and then we would provide that report to the fiscal committee, and then that would help inform the subsequent year's budget.
Okay, Representative McKay.
Thank you, Mr. Chairman. Am I correct that New Hampshire Hospital has now moved the children's to the Hampstead Hospital, and that has now relieved the many emergency rooms that were housing without treatment of mentally ill patients?
Thank you for the question. So you're correct. New Hampshire Hospital here in Concord used to serve both children and adults. It now solely serves adults, which is why this campus in Hampstead, New Hampshire is so important, and why having a lease and a joint operating model where the state holds Dartmouth Health accountable for keeping beds filled and staffed is so important, because it prevents, as you said, the boarding, the waiting of patients in emergency departments, especially vulnerable children.
Thank you very much.
Anyone else? Any other questions for these folks? Okay, thank you very much.
Thank you. Appreciate it.
I don't believe I formally moved the amendment, so I will do that at this time.
Second.
And Representative Weber seconds the motion. Is there any discussion on this amendment? Okay, seeing none, I'll ask the clerk to call the
No,
vote.
yep.
Oh, I'm sorry.
I just, based on what we've just heard, this makes some relatively minor adjustments, which will make the plan much more workable going forward. And therefore, I would hope we would all support it. Thank you.
Thank you.
And thank you for the explanation.
Yeah, thank you. Anyone else? Any other comments? Seeing none, I'll ask the clerk to call the roll. Motion is ought to pass on amendment number 2025-1682H. Mr. Clerk.
Rep. Mazer,
Yes.
Rep. McLean,
Yes.
Rep. Delamus,
Yes.
Rep. Giason,
Yes.
Rep. Polizov,
Yes.
clerk votes yes. Rep. Corson,
Yes.
Rep. McGrath,
Yes.
Rep. Kesselring,
Yes.
Rep. Weber,
Yes.
Rep. McKay,
Yes.
Rep. Woods,
Yes.
Rep. Siebert,
Yes.
Rep. Tejas,
Yes.
Rep. Lamontagne,
Yes.
Rep. Hartnett,
Yes.
Rep. Lucas,
Yes.
Rep. McDonald.
Yes.
Vote is 18-0. Motion passes.
Okay, thank you. I know of no other amendments on this bill. Representative Polazov, did you want to make a motion?
I move for ought to pass on Senate Bill 118 FN.
Ought to pass as amended.
Ought to pass as amendment.
And Representative McLean?
I'll second the motion.
Okay, Representative, I'm sorry, it was actually Representative Drew, but that's fine. Too many MA names here. Representative, okay, any other discussion?
So
Representative Weber?
So am I clear that the motion is ought to pass with both Amendment 1755 and Amendment 1682, which will be combined into a committee amendment?
That is correct.
Okay,
Yes.
thank you. Just
That is
wanted to
correct.
be entirely sure.
Anyone else? Seeing no one else? Okay, again, the motion is ought to pass as amended on SB 118. Mr. Clerk, if you're ready.
Rep. Mazer,
Yes.
Rep. McLean,
Yes.
Rep. Delamus, Rep. Giason,
Yes.
Rep. Polizov,
Yes.
clerk votes yes. Rep. Corson,
Yes.
Rep. McGrath,
Yes.
Rep. Kesselring,
Yes.
Rep. Weber,
Yes.
Rep. McKay,
Yes.
Rep. Woods,
Yeah.
Rep. Siebert,
Yes.
Rep. Tejas,
Yes.
Rep. Lamontagne,
Yes.
Rep. Hartnett, Rep. Lucas,
Yes.
Rep. McDonald.
Yes. Yes.
Vote is 18-0. Motion passes.
Okay, any objection to consent? Saying none. Okay, next.
Who's ready?
Yuri, Representative Polazov, you'll write that report? Okay. Yep, thank you. Next up is Senate Bill 119 FN, and I know we have a couple of amendments on there. Representative McGrath, would you like to offer yours first?
Yes. I only have a couple copies, but it's one simple line. I'd like to move amendment. I need one of those. I need one of those. I'd like to move amendment 1629H
1629H.
Mr. Chairman, I would object if there are not copies for everybody on the committee. I don't think we ought to be voting on it because we have not seen it and have no idea what's in it. And I need to read things as opposed to just listen to them.
I understand, Representative Weber.
I'm sorry, my printer ran out of paper. I'm sorry.
You ask the HH.
Ms. Brandt?
Yes, but it needs to go
Could we
to
get
everyone.
copies of these, this amendment? Are there any other amendments we need copies of made? I'm saying none, okay. Representative McGrath, if you
Should
could
we
give her.
do Yuri's amendment first?
Yes, well, we'll go to Representative Belozoff's amendment first.
Thank you.
Do you withdraw your motion?
Yes.
Okay. All right, we'll proceed with the other amendment, and then, and we'll proceed with yours when we have the copies. And thank you, Representative Weber, that was
Yeah, I'm done.
appropriate. Representative Belozoff.
I move for amendment 2025-1779H to Senate Bill 119 FN.
Okay, and I believe Representative McGrath, you are seconding that?
Second, thank you.
Okay. Representative Belozoff, do you wish to speak to your motion?
We had a hearing on non-germane amendment that would allow standing orders for ivermectin. This amendment is based on what we heard during that hearing with two corrections. First, we heard that if we are talking about pharmacists and advanced practice registered nurses, then according to the logic of our laws, we should include physician assistants because they have qualification to do the same prescriptions. So that's first change that was made. And second, in discussing, it was with representative from other body, and generally to make this bill workable on line 11 and in the paragraph after this on page 4, instead of protocol, it's changed to the word signed prescription. So prescription is something that could be made by physicians or advanced practice registered nurses or physician assistants, and that's how this standing order could be made. So with this two changes, the basic premise is the same. Ivermectin is a Nobel Prize winning drug. It's one of the safest medicines available. So allowing physicians.
Point of order.
Representative Mazer?
Representative Siebert.
Yeah.
How is that an appropriate? What did I just? You
I was just fixing my hair.
No, you did not. You shot yourself. Pretended to shoot yourself in the head. Not appropriate.
I didn't do that.
Yes,
so
you did.
Sorry, you interpreted that as that.
Yes, you did.
Okay. Okay, Representative Belozoff, please continue.
Yeah, and I understand that there are some hard feelings on both sides, and as we heard, this legal framework already adopted by 3 other states, and nobody is forcing physicians or physician assistants or advanced practice nurses to do anything if they don't want to. And the same with pharmacists who may or may not fulfill this prescription. We heard that in one of the states that adopted similar standing order for ivermectin, there are only 2 pharmacists that felt comfortable to help doctors and patients on this issue. So nobody will be forcing anyone with this bill if adopted. Thank you.
Okay, thank you. Okay, anyone else on this amendment?
Yes.
Yes, Representative Weber.
Well, I'm really pretty aghast at this amendment, frankly. First of all, this is a very important underlying bill. And I think the attachment of the amendment makes the underlying bill non-viable, in my opinion. The only standing orders that we have in place at this point, if I understand correctly, and I'm glad to be corrected by anybody with more knowledge than I have, which is almost everybody, are smoking cessation, Narcan, and EpiPens, and I believe that there was one for hormonal birth control, but that medication is now over the counter. I think that making a medication just off our own bat the essential equivalent of an over-the-counter medication without the input of all the usual reviews is very unwise. The medications that have been approved, 2 of them are emergency medicines, and they're used in cases where you don't know that you have an allergy until you have the allergy, at which point you have only minutes to treat the allergy. So a prescription isn't a possibility. And the one time that we had the other medication, there was a very strict protocol under which it could be dispensed, and that was created and followed by pharmacists at that time. So I think this is very unwise and also very unhelpful to the underlying bill. I will be opposing the amendment, and I will be opposing the underlying bill if the amendment is attached. And that's too bad, because this is a bill which is designed to save money and be a relatively simple fix to a problem that needs fixing, but having unwise attachments is simply not acceptable.
Other discussion? Representative Woods and then Representative McGrath.
Thank you, Mr. Chair. I too am somewhat distressed with the proposed amendment. I completely agree. This ivermectin is indeed a Nobel-winning medication, but it didn't get a Nobel Prize for treating COVID or any other virus. It got a Nobel Prize for treating worms. Worms historically had been a huge problem, and that's one of the reasons, and it still is, in third world countries. And that's the reason it got the Nobel Prize, because it has such tremendous impact. The prevalence of worms has been for centuries. And in fact, the true medical symbol, not the caduceus with the 2 wings, but the staff of Asclepius is the true medical symbol. It's a single staff with a serpent on it. And it's thought that, in fact, that serpent is a worm, because the way you extract worms before you had medications, they would come out through the skin. You would begin to wind the worm onto the stick and pull it, and gently over the course of time, you could extract the worm, and that's how the staff of Asclepius. So indeed, it is a big issue. It has been for centuries, but there's been nothing shown. Okay, there have been studies that have been proposed. Some have been completed. Some have been propounded as been completed, but not. And many of the studies which are cited to say that this is a good drug for COVID-related items have been fatally flawed. Yes, indeed, there has been some in vitro studies, i.e. studies in Petri dishes, that show that ivermectin may have some influence on a virus. It's a big step from a petri dish to a human being. It's wonderful to think that we would have some medication that we could take, even though it's safe. I mean, Tylenol is perfectly safe. Why don't we just take it? No studies have shown that Tylenol has any effect on viruses. Ivermectin has not been shown to have any effect on viruses in the clinical setting. We don't want to go down that road. We've done that before. Does Laetrile ring a bell to anybody? It was thought to be a miracle drug for cancer. Huge outcry. Must have it. Well, guess what? It didn't do what it was said to do, even though it was proposed to do so. Bone marrow transplants for breast cancer. This legislative body passed legislation to make it mandatory for bone marrow transplants to be part of a paid treatment for breast cancer. That found out not to be the case. Breast implants, the Dow, that went through the courts and was thought to be a disaster. Turns out the science really wasn't what it was supposed to be. Let's really follow the science in this situation. Let's not bury, and I understand the emotion behind it. I'd like to do anything that's simple. And currently, if your physician wants to, he can write it as a prescription. We do it all the time for off-label. Well, I'm sure a lot of us here may be taking medications that are off-label, and that's perfectly fine. And that's certainly within the purview of physician practice right now. We don't need to legislate that. Thank you, Mr. Chair.
Thank you, Representative Woods. Representative McGrath and then Representative Guyson.
So there were three things that I call my red pill when it came to ivermectin, and one of them was what Rep. Woods was just talking about. In my 40-year career as a pharmacist, never has a doctor not been able to prescribe an approved medication for an off-label use. But doctors were losing their medical license for daring to do just that. And I couldn't understand it. The news media and the government agencies were telling people that if you used ivermectin, it was a horse medicine and you were an idiot. And I thought, that's not right. And then the two major medical journals in the world, the Lancet and the New England Journal of Medicine, published how dangerous ivermectin was. And I thought, that's not right. So I started doing research outside of what the narrative was. And just to back up a little, those two journals retracted those articles and said they were pressured to put those in. And then I found out why all this was happening, and it all came down to money. If there was, and this, I didn't even know this was a law, to get emergency use authorization for these vaccines, there had to be no other treatment. So who was pressuring these journals to put these articles in and pressuring these doctors not to prescribe these medications? And if you looked around the world, yes, there were no official studies, but ivermectin was being used in country after country after country. India first started giving it to all their policemen, and then some of their major cities, they gave it to everybody. In Africa, where they get it regularly, COVID wasn't a problem. Japan was using it, South American countries. So anecdotally, it was helping. There were doctors in this country that were treating all their patients, and none of them died. So doctors will not prescribe the medicine. Pharmacies will not fill the medicine, and that's why this amendment is needed, so that people who want it have access to get it. There probably will be, like Yuri said, very limited pharmacies who actually do it, but at least there'll be a way that people who, again, want to treat themselves because nobody else will treat them, it's a way for them to get it. So I totally support this. Thank you.
Representative Guyson, did you have your hand up?
Yes, Mr. Chair, thank you. So I'd like to point out a couple of minor consistency issues here with development and then with practical application of medicine. First of all, most medications started off as, in quote, animal medications, either through testing, research, etc. Secondly, many medications have multiple uses or are now used for something that they're not designed for. Aspirin was developed as a pain reliever. It is unarguably one of the greatest cardiovascular breakthrough medications there is. They say if you're having heart attack symptoms, chew an aspirin. That is not the intended original use of it. Thalidomide, which was designed as a sedative, is now used for treatment of lesions and in melanoma and leprosy. So many medicines started off as, quote, horse drugs. I think that the patient should have a choice. And there's an inconsistency here also, whereas the government was really pushing for a medication that had not been fully vetted and FDA approved, while denying a medication that hadn't been FDA approved for this purpose, but was already FDA approved. So in this regard, I am going to support this amendment because it's practical usage and individual choice for something that's already approved being used in a different application. Thank you, Mr. Chair.
Thank you. Representative McLean and then Representative Lamontagne.
Thank you, Mr. Chair. So I do understand that having a standing order for this is outside of the scope of what we normally would have a standing order for. It's not an emergent thing, as is the case with Narcan. But the reality is that when COVID happened, unfortunately, this is one area around which things did get politicized. And to Representative McGrath's point, doctors were afraid to prescribe it. So Representative Woods, you are correct. They could get a prescription, but the doctors were afraid to prescribe it because they were being punished. And in fact, since we've had the hearing, I've been driving in my car, listening to the radio, and I hear ads on the radio. Can't find a doctor to prescribe ivermectin, we can help. So these ads that I keep hearing on the radio do underscore, I think, a little bit of what Representative McGrath was saying, that there is a chill in the medical prescription profession about prescribing this. So I think given that climate, it makes sense to go forward, especially given the fact that the legislation is not a mandate. So it basically allows the pharmacists to go in and utilize a standing order or not. So maybe CVS does, maybe Rite Aid doesn't, I don't know, but there's nothing that is telling any of them that they have to do so. So I think this amendment does strike a balanced approach and recognizes the fact that unfortunately this was politicized, and I will be supporting the bill. Thank you.
Representative Lamontagne.
Well, I won't be supporting this amendment. I think we should not be making medical policy off of anecdotal evidence. You talk about, oh, these are patients that want to get this treatment, but a patient is a patient of a doctor, and we're bypassing that altogether, saying you can just walk up to the pharmacy and get this drug that you want to treat for whatever you want to treat. And it has not been approved for those uses. And here you are attaching it to a very good bill that I'm now going to vote against if this amendment is attached to it. It's not, there's nothing in here to protect the pharmacist to say, oh, let's see if you're pregnant, because ivermectin has not been proven to be safe during pregnancy. So how many babies do you want to harm by passing this to let anyone go get a prescription, not a prescription, just get this ivermectin for whatever they want, and we don't even know that this woman is not pregnant. I think this is a very bad amendment, and I don't think we should pass it. We don't make medical policy off of, anecdotal evidence and what we hear on the internet. And therefore, if someone could get a prescription through contacting a doctor online to get that, then that's their choice. They can do that. But we don't make this possible in any pharmacy in the state of New Hampshire.
Okay. Representative Palazzo.
Thank you, Mr. Chair. I would like to respond to some of the critique. First of all, regarding the underlying bill that is intended to save money, but allowing some flexibility with medications. So that's exactly what this amendment is doing. It allowing to save money. We heard some opposition from people whose organizations are selling medications that cost taxpayers multitude of what ivermectin costs. And if anything, I think this amendment doesn't go far enough, and I'm sorry for it. If we talk about flawed studies, then Pfizer COVID vaccine study was very flawed, and I'm talking about it because that's one of the issues where ivermectin was used in multiple countries, as we heard, as cheap alternative and safe at that. If we take New Hampshire, not a single kid died in New Hampshire after taking ivermectin, but according to CDC virus database, we have multiple cases, including some kids around 2-year-old who died after taking COVID vaccine. So I'm sorry that this amendment doesn't include children. And if you look at line 19 on page 1st, it also doesn't include pregnant patients. So those will not be dispensed with ivermectin. So if anything, it should go further, but at least for people who are not pregnant and over 18 years of age, I think they should get access. Thank you.
Okay, Representative Hartnett and then Representative DeLamus.
Thank you, Mr. Chair. I, too, am really disappointed with the amendment. I was really looking forward to supporting the underlying bill, and now I won't be supporting either. It's obviously a controversial subject. I wish we could have dealt with it separately and not corrupted the underlying bill. It's a shame. Thank you.
Thank you. Representative DeLamus.
Thank you, Mr. Chairman. I'm just going to read something really quick because I think it's good information. This is from the National Library of Medicine. We believe that the evidence to date supports the worldwide extension of ivermectin treatments, and it specifically says for COVID-19, complementary to immunizations. So if someone, that it can be used in conjunction with the indicated biological mechanism, and some of this language is something I'm not familiar with, but bear with me. The indicated biological mechanism of ivermectin, competitive binding with SARS-CoV-2 spike protein, which I kind of understand, is likely not epitope specific as reviewed, possibly yielding full efficacy against emerging viral mutant strains. Ivermectin has been safely used in 3.3 1.7 billion, that's with a B, doses since 1987. And I'm going to stop myself right there and say I would assume that after that many doses being administered worldwide, that it's probably been proven to be pretty effective and pretty safe, because if there was a problem, we would certainly know about it. Certainly we would. 3.7 billion doses since 1987, well tolerated even at much greater standard doses, and used without serious AEs, and I don't know what that is, doctor, you probably do, in the 3 high-dose COVID-19 treatment studies noted above, and if you go to the National Library of Medicine, the studies are listed there. In the current international emergency of COVID-19 with mutant viral strains, vaccination refusals, and potentially waning immunities over months presenting new challenges, ivermectin can be an effective component of the mix of therapeutics deployed against the pandemic. And once again, I'll repeat, that's the National Library of Medicine. And I remember when ivermectin came out, because I'm a horse person, I was down in Virginia and we were having trouble with Potomac fever, which was spread by insects, but it wasn't a worm. And it was highly effective. It was given to pregnant mares and administered, it's still administered today. And I've said this before, very often animals, including us, we're specific to the host. Whatever medication is being used, you can't give a dog the same medication you can give a cat. You can't give a cat the same medication that a human takes. With ivermectin, it goes across the board safely. It affects all of those creatures with a level of safety. So I will be supporting this, and I'm actually very happy to be supporting it. Thank you, Mr. Chairman.
You know, I was until now, I didn't realize that Potomac fever affected horses. I thought it only affected Washington politicians. Representative Siebert.
Yeah, I just want to say, I don't think people are, we're not in here saying that, the ivermectin is not safe, but I think there's also a standard in medicine as to what it's being used for and what it's been studied to actually, been proven to treat and studied in humans, so that we know that it's safe to treat that specific, condition, because we have a lot of medications, as we've spoken about here, that treat multiple things. But that's after it is studied and then approved, because, then we know you don't have any adverse effects from it. And then second of all, I would just like to add, I've been doing a lot of genealogy research recently. And, you'll pull up where someone's obituary is in a paper, and sometimes I'll scan on the other parts of the paper. And you just wouldn't believe the amount of claims people have made in the past over medications, and put it in the paper and say cure-all and this cures this and that. And how many of those I looked up, and they were horrible for people. I mean, this is why we've created this standard in medicine and for pharmacy, is to avoid, people claim to everything, and it's actually really scary when you look at it. So, thank you.
Thank you. Anyone else? Seeing no one else, okay. Motion is ought to pass on Amendment 2025-1779H. Mr. Clerk, if you'll call the roll.
Rep. Mazer?
Yes.
Rep. McLean?
Yes.
Rep. DeLamus?
Yes.
Rep. Geisen?
Yes.
Rep. Polzov?
Yes.
Clerk votes yes. Rep. Corzine?
Yes.
Rep. McGrath?
Yes.
Rep. Kesselring?
Yes.
Rep. Weber?
No.
Rep. McKay?
No.
Rep. Woods?
No.
Rep. Siebert?
No.
Rep. Tejas?
No.
Rep. Lamontagne?
No.
Rep. Hartnett?
No.
Rep. Lucas?
No.
Rep. McDonald?
Yes.
Vote is 10-8. Motion passes.
Okay, and Representative McGrath, I believe we now have a copy of your amendment, 1629H. You still don't have a copy?
Here you go.
Okay. Does everyone have a copy now? Okay. Okay. Okay, thank you. All right, Representative McGrath moves,
I'd like to move my amendment 1629H.
okay, and Representative McLean,
I'll second, Mr. Chair.
okay? And Representative McGrath, you wish to speak to your amendment?
Yes, so the full amendment is amend the bill by deleting section 3. So this bill has two separate parts to save money. The second part that the amendment would like to delete basically gives the chief medical officer the ability to put in a standing order for Medicaid patients, for over-the-counter medicines, medical supplies, and laboratory tests. So I immediately called Gary Merchant to find out his views on this, because it might save the state money, which it is proposed to do, but it would put all the burden on your neighborhood pharmacy, which is already overworked. And he agreed, especially since pharmacies probably lose money filling inexpensive over-the-counter Medicaid prescriptions. And there's no other reimbursement for pharmacist time, even though there's a standing order. You still have to counsel the patient beforehand, which would be the case with the previous amendment also. And so my concern is you're overwhelming the pharmacies, and pharmacies that are in poor areas with a high Medicaid population would be the most overburdened. And then there's also the possibility that they might have to go out of business, not being, I mean, depending on, this is so vague. If you have hundreds of items that Medicaid patients come in and ask to fill a prescription for, that they may not even be able to stay in business. So Gary Merchant wanted to retain the bill, and he offered to work on it. Unfortunately, that would mean the first part of the bill that saves money wouldn't get passed. So I would like to pass this amendment to remove paragraph section 3 and work on that for next session.
Any other discussion? Representative Weber?
With all due respect to whatever conversations you've had, we had overwhelming support for this when it came to our committee, and I object to the further watering down of what was an exceedingly helpful bill. I don't think this helps pharmacies. I don't think it helps anybody, and it certainly doesn't help Medicaid patients who I would like to help. So I will be voting against this amendment as well. Thank you.
Representative Seabrook.
I'd just like to add that pharmacists are really on top of like what medications cost, that, you know, extra work. They seem to already be on top of their game when it comes to all this stuff. So I'm not sure how much extra research they would in the end need to be doing. And furthermore, I would just like to say, just to add on that, you know, the underlying bill is a really good piece of legislation, and it's something we could actually do where we're not playing political games, and we can actually help the people of the state of New Hampshire and do good work and go home and tell our constituents that. So if there are other pieces we want to tack onto this, you know, it's obviously because they can't stand alone by themselves. So I would just like to say that it's not my fault if this does not pass. Thank you.
Other discussion? Representative Tejas.
Thank you, Mr. Chairman. I find this interesting. I read this very differently. I read this as the chief medical officer can issue a standing order versus an order written by an individual physician, so that's one piece of it. And really what it's doing is increasing access when needed to things like medications, medical supplies. So think about people who need supplies for insulin, or, you know, really it's about facilitating access. And as was stated already, we had a lot of support for the underlying bill.
Okay, thank you. Anyone else? Seeing no one, I'll ask the clerk to call the roll. Motion is ought to pass on Amendment 2025-1629H.
Rep. Mazer,
Yes.
Rep. McLean,
Yes.
Rep. Delamus,
Yes.
Rep. Geisen,
Yes.
Rep. Polizov,
Yes.
clerk votes yes. Rep. Corzine,
Yes.
Rep. McGrath,
Yes.
Rep. Kesselring,
Yes.
Rep. Weber,
No.
Rep. McKay,
No.
Rep. Woods,
No.
Rep. Siebert,
No.
Rep. Tejas,
No.
Rep. Lamontagne,
No.
Rep. Hartnett, Rep. Lucas,
No.
Rep. McDonald.
Yes.
Vote is 10-8, motion passes.
Okay, Representative McGrath, did you have another motion on the overall bill?
Yes, I'd like to move OTP 119A with the two
Ought to pass
amendments.
as amended on 119?
Yeah.
Okay. And Representative Mazer, I believe.
Second.
Okay, any other discussion? Did you want to speak to that motion or?
Yes, I'd just like to add, I mean, we've discussed the amendments. The original bill had two cost-saving parts that were separate. The first part is still an excellent cost-saving part that pharmacists can dispense whatever's cheaper to Medicaid beneficiaries, the brand or the generic. Right now, they're directed to only dispense the generic, even if it's more expensive.
Any other discussion? Seeing none, I'll ask the clerk to call the roll. Motion is ought to pass as amended on SB 119.
Rep. Mazer,
Yes.
Rep. McLean,
Yes.
Rep. Delamus,
Yes.
Rep. Geisen,
Yes.
Rep. Polizov,
Yes.
clerk votes yes. Rep. Corzine,
Yes.
Rep. McGrath,
Yes.
Rep. Kesselring,
Yes.
Rep. Weber,
No.
Rep. McKay,
No.
Rep. Woods,
No.
Rep. Siebert,
No.
Rep. Tejas,
No.
Rep. Lamontagne,
No.
Rep. Hartnett, Rep. Lucas,
No.
Rep. McDonald.
Yes.
Motion, vote is 10-8, motion passes.
Okay, and I'm sure there'll be a minority report. Do we know who's writing that or?
I'll do it.
Okay.
And who's writing ours?
Representative McGrath, you're writing the majority report.
Sorry, who was minority?
Representative Weber. Okay, going to page 2. SB 130 is next up, and I will move ITL on that. Representative Polizov, I believe.
I second.
Representative Polizov seconds. Again, this is a well-intended bill. It's a worthy bill. And that's always a concern when I look at anything. But I also look at the practicality and the experience we have had. We actually had a committee on commissions last term. It did not, great people were involved. I told the leadership of that committee, which no longer exists, that they needed to use a hatchet. Instead, they used a scalpel, and consequently, we eliminated very few commissions, and I think we eliminated like 16 and passed another 30 last term. The problem with commissions is, number one, it is very difficult for the leadership of both legislative bodies, the Senate President and the Speaker, to find people who'll serve on them. I'm on a commission right now where, there's 2 members of each body on it, from each political party, and I make most of the meetings. My colleague from the House does not. And the same with the Senate. The one senator shows up, the other one does not. And again, I know everybody's busy. I'm not saying that people don't care, but it's, people are stretched thin. It's very difficult to find people to serve, and even when they maybe reluctantly agree to serve, it ends up being that they don't show up because of conflicting schedules. So it is for that reason that I am moving ITL on SB 130. Any other, Representative Woods?
Thank you, Mr. Chair. I'm much in favor of this particular bill from the perspective that, as we see in a variety of venues around our country, there's been widespread damage from hurricanes and a variety of other, entities requiring regional interventions. I can't personally state, and I may be incorrect, but my understanding is that we don't have good regional response systems in place. Example, let's say Portsmouth Hospital for some reason goes down. I mean, completely. What are we going to do with those patients in terms of transport, et cetera? Other disasters that may befall, we need not just transportation, but treatment issues. And I think it's worthwhile to look at those ahead of time. And we've found out with some of the issues in especially the mid portion of our country that we are really not very well prepared. I think it, prevention, as we know, is, very worthwhile. And I think this would reflect that to plan not just for a single entity, but a variety of issues. And I think our emergency services are sufficiently complex and have changed over the course of the last 15 to 20 years that even if there was a plan in place, I think it'd be very much worthwhile to be prepared and look at that in depth again and coordinate it, not just within New Hampshire, but what are we going to do in terms of relationship to Boston or other regions as well? We may need to be responsive if there is a disaster in Boston. It might be a center for a terrorist attack or something. What would happen? How can we respond? And I think it's worthwhile to be a good player in that regard. And as the old Boy Scouts saying is, be prepared. And I'm not too sure we are.
Okay. Thank you, Representative Guyson.
Thank you, Mr. Chair. To your point, sir, with respect, these agencies actually do already exist. FEMA, the federal government, and the National Guard all work in conjunction with a program called SURF. One of the things the United States is very good at is moving patients. One of the reasons that during the COVID response, I was actually a first responder, and we were building field hospitals and getting ready to have an overwhelmed hospital system. And one of the reasons that we never had an overwhelmed hospital system, but Italy had many, was because we routinely transport patients. We do it regularly here, and that's not a common practice in Europe and many places. So, like, we know if you have a heart attack right now, you're going to the nearest hospital to stabilize you, and then you're probably going to CMC because that's one of the leading heart hospitals in New Hampshire. We know if it's a C-spine and it's severe, even though it's a VA hospital, you're probably going to Jamaica Plain because that's one of the best C-spine wards in the Northeast. We do that routinely. So we're already good at transporting patients. We already have the emergency management systems in place to transport patients in a hurry, and we already have access to the National Guard. And quite frankly, no matter what program we sit down and plan for, you're never going to know what the emergency is until it hits. So that's why we need to fall back on the people that have trained for these things, and those programs are in place, sir.
Anyone else? Seeing no one else? Oh, Representative Tejas.
Thank you, Mr. Chair. I agree with the representative. There are systems that come into play when there are emergencies, as described by Representative Woods. I understand the bill to be specifically about like EMT, emergency service providers. If you look at the original bill that was introduced in the Senate, it had to do with ambulance billing and all sorts of other things. And all the various testimony that was provided resulted in the amended version that we ended up receiving. So what was clearly identified is there's a need for study related to emergency services, such as related to ambulances and how it's financed and how there's places who are not appropriately served right now. And so that was the rationale.
Thank you. Anyone else? Seeing no one else, I'll ask the clerk to call the roll. Motion is ITL on SB 130.
Rep. Mazer,
Yes.
Rep. McLean,
Yes?
Rep. Delamus,
Yeah.
Rep. Geisen,
Yes.
Rep. Halsov,
Yes.
clerk votes yes. Rep. Corson,
Yes?
Rep. McGrath,
Yes.
Rep. Kesselring,
Yes.
Rep. Weber,
No.
Rep. McKay,
No.
Rep. Woods,
No.
Rep. Siebert,
No.
Rep. Tejas,
No.
Rep. Lamontagne,
No.
Rep. Hartnett, Rep. Lucas,
Nope.
Rep. McDonald.
Yes.
Vote is 10-8, motion passes.
Now, I think a majority report. In terms of a minority report,
Representative Tejas has very kindly just.
thank you, Representative Tejas. Okay, next up is Senate Bill 134. I am moving to retain that bill.
I'll second.
Okay, and my purposes are, thank you, Representative McLean. My purposes are simply, it's an important issue, but it's a complex issue. There are legal questions through both the judicial branch of the federal government as well as the United States Congress. It has been a legal problem for New Hampshire in the past, and we want to make sure that if and when we do this, we do it correctly. So those are my concerns, and I know there's a great deal of interest in this issue. Amendments have been proposed, detailed amendments, and they've all come in very recently, and certainly as the deadline for retention or as the fall arrives, because during the summer it's hard, we're discouraged by leadership to do too much, at least on a formal basis during the summer, but as the process unfolds, we will give this bill careful consideration and hopefully come up with the right outcome. Representative Weber.
Thank you, Mr. Chairman. And much as I would like to honor the 477 people who signed up in opposition to this bill, in addition to the numerous organizations who have also signed on to opposition letters, and I note that the sign-ins online were 9 in favor and 477 opposed, plus all those different organizations. I do recognize the wisdom of waiting until we have a clearer idea of what the federal legislative background is. And so I will not go into all the reasons for opposing the bill because there are many. And I think retention gives us an opportunity to react more appropriately when we understand what the regulatory landscape is going to be. So I will be voting also to retain this bill. And I will be very glad to work on it at whatever time the chair deems appropriate.
Thank you. Representative McLean.
Yeah, thank you, Mr. Chair. And as Representative Weber kind of stated, we heard testimony that there's 3 different pieces of legislation federally going through with respect to that. We don't know how that plays out. And while I'm personally a supporter of work requirements as a hedge against fraud, incentivizing work, we tried this before. If we go through with this legislation as it is, we will be sued. We will lose. There were the questions that Representative Weber raised with respect to who was going to be exempted from the work. And when we tried to roll this out in 2018, less than a third of the people signed up. So the governor had to step in and suspend the program. As it is right now, if we go forward with this as it is, it's just rinse and repeat. We should hold on to this until we understand the landscape better.
Anyone else? Seeing no one else, I'll ask the clerk to call the roll. Motion is to retain Senate Bill 134.
Rep. Mazer,
Yes.
Rep. McLean,
Yes.
Rep. Delamus,
Yes.
Rep. Geisen,
Yes.
Rep. Halsov,
Yes.
clerk votes yes. Rep. Corson,
Yes.
Rep. McGrath,
Yes.
Rep. Kesselring,
Yes.
Rep. Weber,
Yes.
Rep. McKay,
Yes.
Rep. Woods,
Yes.
Rep. Siebert,
Yes.
Rep. Tejas,
Yes.
Rep. Lamontagne,
Yes.
Rep. Hartnett, Rep. Lucas,
Yes.
Rep. McDonald.
Yes.
Vote is 18-0. Motion passes.
Okay.
Hey, first sensical thing today.
I'm sorry?
Oh, nothing.
Oh, okay. Okay, Senate Bill 138 we considered previously. Next up is Senate Bill 202. Representative DeLamus, do you have a motion? And I will second. Do you wish to speak to your motion?
Yes, thank you. And it's really anecdotal. What I'll say about this is when my mother came to be with me, she was driving her car. 7 years later, she died in my arms. And when it took me, and I studied this, I went to group every week, and I took a course in Alzheimer's, and it really took me to seriously wrap my head around what Alzheimer's really is and what it really does. It took about 2 good solid years for me to realize that I was expecting way too much. And I think that in an emergency situation, or even in situations where patients have this particular problem and they're in a facility, I used to make every nurse that came to take care of my mom watch a 3-minute video that I have that explains Alzheimer's very succinctly and very clearly, because I wanted to have something to do with training the people who were going to be dealing with my mother and helping me take care of her. And I believe that it's very important that people who are professionally in the field are trained to the utmost when dealing with someone who does have dementia, because it's not the same as being a psychopath or having some other mental problem. Your brain is actually dying. You lose gray matter, and the processes that would normally be great for us is we just expect everybody to be able to think. It just isn't there. So for that purpose and that reason, I am going to be moving this to OTP.
Thank you. Anyone else? Representative Palazzo.
I need some help on this bill on line 6, and otherwise I'm really confused because when I read fiscal note and the bill is written, it's 2 different bills. Because when I'm reading it seems like we are just adding some committee member and some scope, but fiscal notes talks about specifically training expenses, and I don't see it in the bill itself. I checked line 6 that says about RSA 126A15A 3C4, and it's just about scope of the committee. It does not directly require some specific training expenses. So can somebody explain me why fiscal note and some discussions around this bill talk about us requiring some additional training, but I don't see it in the bill itself.
Representative Weber.
I certainly don't have any apologies or explanations for the fiscal note. I think the bill as written is very important, and I would amply second the statements of Representative DeLemus. For those who have family members who have been afflicted by this disease, it's very different in every single person, and it's important that responders understand that, and that there are many different techniques that need to be thought of, tried, worked on, and so I'll be supporting the bill.
And Representative Belozoff, I don't have an answer. It's not my bill, so I don't have an answer for you on that either. But is there any other discussion? Representative Drew.
I went off of the fiscal note, and it's my understanding that the addition of that person to the committee is what triggers that training requirement. So I'm assuming that the methodology in the fiscal note is not misleading. And I want to say everything Rep. DeLame said is absolutely correct. This is a critically important area of care. The problem is that this is a fairly extensive training requirement that in the bill does not have any funding. And the fiscal note notes that it'll be relatively inexpensive for the Department of Safety to provide this training. However, the amount of money that would need to be paid at the county and town level to get this training is simply not covered. So what we're doing is telling people you have to get this training or not giving them any money to do it. So that's my objection.
Can we get clarification if they have it?
Yes, would you like to testify? Oh, sure, absolutely. Sure, Representative Weber.
I too am looking at the bill, and I agree with Representative Belozoff. This is a study committee, a committee that's working on solving issues and proposing solutions. I don't, as a committee or a commission, they have absolutely no authority other than what is in the proposed legislation to require extra stuff. So I am at a loss because I think that it's likely that we would need further legislation at that point. So I just put that out there as my agreement with Representative Belozoff, but I'd love to hear.
Before we go to Ms. Horgan, Representative Mazur.
Yes, thank you, Mr. Chair. Yes, I would also like to hear what we just heard, why even the title of it conflicts with the methodology, where it says it directs the Department of Safety to provide education and training of fire service personnel, when that's not mentioned or addressed anywhere in the bill, only in the methodology. So if you could answer that.
Ms. Horgan, if you could introduce yourself and proceed.
Thank you, Mr. Chair. Jenny Horgan, Senior Public Policy Manager for the Alzheimer's Association. So what had happened, and I think I can shed some light on this, is when we originally had met with Senator Prentice, we had discussed the possibility of legislation that would require training. Through the drafting process, and she originally moved forward with a submitting training, but then before the bill was signed off, we had discussions with EMS and with other groups along with the senator, and decided that moving forward through the Medical Control Board process, which we have been working with our EMS community partners on, was a more appropriate avenue for training and getting that included in their scope of practice. So when the bill actually was introduced, which has created this kind of weird situation where the title and the fiscal note was with the language that the senator originally submitted to OLS versus what originally came out as the bill is introduced. So the bill is introduced, and the bill that you would be taking up right now is solely adding a member from the EMS community to the subcommittee on Alzheimer's dementia and increasing the scope of review for the subcommittee, as well as adding a member of the Alzheimer's Association to the, I can't remember the exact name, it's not the Medical Control Board, but to a board as well. So that fiscal note is with the original language that the senator submitted to OLS originally, and not what actually got introduced, which is the subcommittee edition. So this bill would not be adding any training requirements or anything like that. We're working with the Medical Control Board, and we're very grateful for their partnership and hearing from us on that. And that is what we're looking to do with this bill, solely add members to the subcommittee and to the board.
Thank you. Representative McGrath.
Can you explain increased scope of review?
So duties. So the duties of the subcommittee is currently to look at the state plan, to look at how different communities are impacted by Alzheimer's and dementia. So just like any study committee has duties, it's that intention would be of this to allow or to direct the subcommittee to examine EMS responses to people living with Alzheimer's and dementia.
Representative Kesselring.
Thank you, Mr. Chair. I don't know if it's so much of a question, but looking at the bill itself, based on the testimony, it looks as though the RSA is incorrect based on the way it is. I don't know if that was edited from the original bill. Again, I might need clarification on that too for this, because it looks like RSA 126 is listed, but then down below it's amended 153. So which bill or which, I mean, it looks like we might be amending both of them, but.
So I don't have the bill in front of me, so I may be wrong, but I'm wondering if potentially one section is referring to the subcommittee and one section is referring to the Emergency Medical Services Board. I think. I don't know. I don't have it in front of me, so I can't, but that would be potentially the reason why we're amending two separate RSAs. We're amending the subcommittee and that Emergency Medical Services Board.
Let me bring you a copy if you want to come up.
Yeah.
So can I just get?
Sure, Representative Mazur.
Thank you. So final clarification. This bill only adds a member to a committee that already exists.
Yes, so the Subcommittee on Alzheimer's and Other Related Dementia is chaired by Senator Avard. We meet usually on a monthly basis. We've taken a little bit of a break, but we're usually meeting on a monthly basis. It's a subcommittee of the Health and Human Services Oversight Committee. So that is what we're adding an EMS personnel member to that, and then expanding the duties of that subcommittee to look at EMS responses to those living with Alzheimer's and dementia. And then RSA 153 is a separate statute that has to do with the Emergency Medical and Trauma Services Coordinating Board that would be adding a person from the Alzheimer's Association to that to just kind of create more collaboration and communication between these two groups, because as has been pointed out today, Alzheimer's and dementia is a growing issue in the state. As Representative DeLamus very, aptly stated, it's a complicated disease. It's hard to understand. So we just want to create more communication and collaboration with our EMS personnel and hopefully make the experience better and more effective for people living with the disease, their family members, and EMS personnel when they are engaging with people in that community as another tool in their toolbox.
Follow up.
So the analysis is what's accurate,
Yes.
not the
So
methodology.
The FN is that original language that Senator Prentice submitted, but that did not actually get introduced.
Anyone else? I'm seeing no other discussion. Okay, thank you very much for
Thank
coming
you so
forward.
much.
Change my vote, so.
Yeah.
Thank you, Ms. Horgan.
You changed my vote, so.
Sorry I missed your call the other day, by the way.
I have a question.
Yes, Representative Tejas.
So given this confusion from looking at what's written, is there something that would change before it goes to the floor?
Representative Weber.
I don't think so, because the stuff that we're objecting to is not part of the original bill. And therefore, it doesn't need to be amended if people are in agreement with the actual language of the bill. And we have now had it explained to us why there are two wildly divergent statutes that are being amended. We're adding representation to two different bodies. So I think that the bill as written appears to me to be fine. I like it. I'm only speaking for myself. But the pieces that are problematical do not become law. So it doesn't need to be changed in that respect. And as far as we can see, it doesn't need technical changes to an RSA reference either, because it's talking about two different bodies.
Any other questions or discussion? Seeing none, I'll ask the clerk to call the roll. Motion is ought to pass on SB 202.
Rep. Mazur?
Yes.
Rep. McLean?
Yes.
Rep. DeLamus?
Yes.
Rep. Guyson? Yes. Rep. Polizov?
Yes.
Clerk votes yes. Rep. Corzine?
Yes.
Rep. McGrath?
Yes.
Rep. Kesselring?
Yes.
Rep. Weber?
Yes.
Rep. McKay?
Yes.
Rep. Woods?
Yes.
Rep. Siebert?
Sorry. Yes.
Rep. Tejas?
Yes.
Rep. LaMontagne?
Yes.
Rep. Hartnett? Rep. Lucas?
Yes.
Rep. McDonald?
Yes.
Vote is 18-0, motion passes.
Okay,
Yeah.
Representative Weber moves consent. Is there any objection? Okay, seeing none. Representative Delamish will write the report. Okay, thank you. Okay, moving on to SB 243. I'll make a motion and then I'll speak to the motion. I'm going to move ITL. Representative Mazur?
Second?
Thank you. This is a difficult one, another very, very important issue, no question about it. A number of concerns, not the least of which is the appropriation that would be required in a very difficult budget year. And that certainly is a huge factor for me. And again, we have a lot of important things we need to deal with this year, and this is not unimportant. But we got to pick we got to make decisions. So that is why I do what I do. So, Representative Weber.
I very much oppose a motion of ITL. I think this ought to pass. We have heard again and again and again and again that we need workers. If we need workers, we need parents to be able to leave their children in safe and reliable facilities. We have been asked to do this over and over and over again. The vote was 300 on the sign-ins online. Sorry, it's not a vote. We're 311 in favor and 6 opposed. And I don't know about anybody else, but my email box has been flooded for the last week with people begging for this service. I do understand the point about the budget, but this is a policy committee. I'm still bewildered why this didn't go to Children and Family Law, because we have a committee that specifically deals with this, but it came to us, and I think that the policy is that we ought to have more good, reliable childcare that allows parents to work without paying the sum of money per year that is almost the equivalent of the cost of my first house. And so I will be fervently opposing ITL and hoping that we can overturn that and get it not to pass.
Thank you.
And if there are issues, and I understand that there are issues with cost, that is for the finance committees of the two bodies to take into account and then reconcile as a budget matter, rather than simply killing it in the policy committee because it's good policy.
Thank you. Representative Lamontagne.
Yes, I'm also opposing the ITL. I think that there's so many good things about this bill that are trying to streamline the process for both the providers of childcare, particularly for the providers, trying to get out of really cumbersome reporting requirements and having new requirements that are consistent with federal requirements for that. And I think the presumptive eligibility pilot program is hugely important, because here you have someone that if they can find childcare, they're ready to go back to work, and it will help the childcare provider to accept them presumed eligible for the supplement. Without that, people are stuck waiting to get that before they can start work. It's such a good policy to help move forward to address some of our childcare concerns, which are at a crisis that we heard from so many people about this. And, it is an appropriation, but in the scheme of things, it's a very small one. And as Rep. Weber said, that we can address this in the Finance Committee and the budget. I just, we should be here for the public interest. And that's what this bill does. Address a very serious problem. And I hope that we can support this bill and defeat the ITL.
Thank you, Representative Mazur.
Thank you, Mr. Chair. So I just heard it's a small appropriation, but $200,000 just for a study and an additional $171,000, so $371,000 for a study and a systematic review. That's a lot of money for just those two things. And I put in my notes that does this put us in conflict with federal law too? That's a question on this as well. So while I realize the intent of this is good and it sounds like this is very needed, there's just too many questions in this still for me.
Representative Kesselring.
Thank you, Mr. Chair. So I'm definitely for streamlining the process. Looking through this bill, there's certain things that I do like, and there's the appropriation, like you said, for specifically making it available so that there's that preemptive thing so that the child care facilities can have that. Those could be separate items, and I would encourage people to bring those things back because I personally support those items. But as far as the bill goes in its entirety right now, I'm going to have to go in favor of the ITL motion.
Anyone else? Representative Lamontagne.
Yes, but the presumptive eligibility is the pilot study. And the big perspective of it, that's what it would cost to do that, to make sure we get it right? You want to develop a system that works well, but it'll enable some people to be the test pilots on this. It's a relatively small appropriation for what it's asking to do. If you want that policy, you want to study, get it right, help develop the system for that to work.
Representative Kesselring.
Thank you, Mr. Chair. Just as a follow-up, so if we streamline the process and we see how that works, would that not fix some of the issues is the question that I have. So I just want to state that.
And be the potential for new legislation, you're saying, right? Representative Hartnett.
Thank you, Mr. Chair. I'll be voting no on the ITL. Broadly speaking, I just see this as a pro-family bill, simply.
Okay, thank you. Representative Polazov.
I support the motion because I oppose to the idea of further taking control and funding of childcare. We have presumption that if government take control of childcare, that cost and quality will remain the same, but we see with public schools that cost is increasing very fast. And when government got involved in helping with student loans, now going to university is becoming expensive with crazy speed. So I'm afraid that it won't achieve what it is trying to achieve. Thank you.
Thank you. Representative Lamontagne.
I guess I just want to point out, if you don't think the government should subsidize childcare anyway, I think you're assuming then that women, grandmothers will continue to do the unpaid work of providing childcare for the state of New Hampshire.
Okay, I'm seeing no one else. I'll ask the clerk to call the roll. Motion is ITL on SB 243.
Rep. Mazer,
Yes.
Rep. McLean,
Yes.
Rep. DeLamus,
Yes.
Rep. Geisen. Yes. Rep. Polzov,
Yes.
clerk votes yes. Rep. Corzine,
Yes.
Rep. McGrath,
Yes.
Rep. Kesselring,
Yes.
Rep. Weber,
No.
Rep. McKay, Rep. Woods,
No.
Rep. Siebert,
No.
Rep. Tejas,
No.
Rep. Lamontagne,
No.
Rep. Hartnett, Rep. Lucas,
No.
Rep. McDonald.
Yes.
Vote is 10-8. Motion passes.
Would you do that one? Representative Lamontagne has
Okay.
kindly agreed.
Thank you. All right, very good. Okay, thank you. Next up is SB 248. Representative McLean.
Thank you, Mr. Chair. I'll move ought to pass on SB 248.
And Representative DeLamus. Representative DeLamus seconds. Representative McLean, do you wish to speak to your motion?
Yeah, just briefly, Mr. Chair. So we've seen in this legislature, indeed across the country and elsewhere, there's been a huge push of late, for medical aid and dying. That's a trend that makes me very nervous. They have it in the place where I was born, Canada. But I really think that if you want to be credible in your opposition to that, you have to have workable alternatives for people. And having effective palliative and hospice care in the state, I think is something that's very important. I think that this bill puts forth a committee and not a commission. I understand, the burden with the commissions right now, but this keeps it lean. It allows us to go forward as a committee. And so I hope you'll support the bill.
Okay, anyone else? Representative Weber.
And I would just add to that, that as somebody who very much supports the personal choice for all ends of life options, including medical aid in dying, I entirely agree that we should be doing much better with respect to palliative care and hospice care so that every person has the full range of control and options at the end of their lives. And I think we owe that to everybody. So I too will be supporting the ought to pass. Thank you.
Okay, thank you. Anyone else? Representative Palazzo.
I will be voting against it. I understand that it's important topic, but it's yet another committee, and also it's not quite clear for me how it's connected study of hospice care in general and that polarized issue of assisted suicide. So it will be like depending on who gets on that committee. So I think it should be studied outside of the proposed committee.
Okay, thank you. Anyone else? Oh, Representative McLean.
One of the things, though, as you probably heard from the discussion that we had earlier, Representative Palov, that no matter where we stand on medical aid in dying, which is controversial, I think there's not as much controversy and politicization around hospice and palliative care. And so I think that this is a study that actually will go forward where we're actually going to be studying it from a non-political perspective. I think the amount of that will be minimal on this committee. So I do hope you support it.
Representative Tejas.
Thank you, Mr. Chairman. And to add on, I think if we had really robust hospice and palliative care, we wouldn't need the medical aid in dying at all.
Anyone else? Seeing no one, I'll ask the clerk to call the roll. Motion is ought to pass on Senate Bill 248.
Rep. Mazer?
Yes.
Rep. McLean?
Yes.
Rep. DeLamus?
Yes.
Rep. Giason?
Yes.
Rep. Polzov?
No.
Clerk votes no. Rep. Corson?
Yes?
Rep. McGrath?
Yes.
Rep. Kesselring?
Yes.
Rep. Weber?
Yes.
Rep. McKay?
Yes.
Rep. Woods?
Yes.
Rep. Siebert?
Yes.
Rep. Tejas?
Yes.
Rep. LaMontagne?
Yes.
Rep. Hartnett?
Yes.
Rep. Lucas?
Yes.
Rep. McDonald?
Yes.
Vote is 16-2. Motion passes.
Okay, is there any objection to consent? Okay, great, thank you. Next, I will, Representative McLean, you'll do the report on that?
Sir.
You'll do the report on 248?
I'll do the report on 248.
Yes, okay, thank you. Senate Bill 251 is up next. And Representative Drew, I believe.
Thank you, Mr. Chairman. I move to ITL SB 251. 251.
Yeah, Representative McLean, do you?
Second.
Okay, you second. Do you wish to speak to your motion?
My objection to this is very basic. This is yet another commission that we're establishing to study something that we already have an extensive infrastructure to deal with. And so I don't believe that this commission is necessary.
Thank you. Any discussion?
Again,
I was gonna say,
Again, I think that the same comments I had earlier, regional healthcare is, we've discussed it to some degree, but I think it's something that needs to be addressed. The emergency part, which we addressed earlier, but this is a broader look at that issue. And I think is very much worthwhile for, again, as we saw with COVID planning, I mean, we were caught a little bit behind the 8 ball on that. And there's a variety of other issues, not just COVID, but I mean, disasters, and that fits into the previous one that we talked about. And so I think the regional planning, and again, emphasizing regional meaning, not just New Hampshire, but in regional meaning, how can we coordinate with the needs for across the border, Maine, Vermont, Mass, and because as we can see, healthcare is, whether we like it or not, is really becoming much more regional. Just like we found that, you know, we're not just in a hospital, we have all kinds of other facilities, and that we had to address earlier. So in that sense, I think looking at this is very much worthwhile.
thank you. Anyone else? Seeing no other discussion, okay, so we'll ask the clerk to call the roll. The motion is ITL on Senate Bill 251.
Rep. Mazer,
Yes.
Rep. McLean,
Yes.
Rep. DeLamus,
Yes.
Rep. Geisen,
Yes.
Rep. Polzov,
Yes.
clerk votes yes. Rep. Corson,
Yes.
Rep. McGrath,
Yes.
Rep. Kesselring,
Yes.
Rep. Weber,
No.
Rep. McKay,
Yes.
Rep. Woods,
No.
Rep. Siebert,
No.
Rep. Tejas,
No.
Rep. LaMontagne,
No.
Rep. Hartnett. Oh, he's not there. Rep. Lucas,
No.
Oh, and me,
Rep. McDonald.
yes,
Sorry.
that's all right.
Vote is 11-6. Motion passes.
11-6 and then 1 absent, is that it?
Yes.
Okay, I don't believe that can go on consent. Will there be a minority report or? Representative Wood, you're doing the minority report? Okay, thank you. Representative Hartnett, you're not allowed to go to the bathroom or anything, you know. Just kidding. Representative McLean. Oh, no, it's gonna be a Matt Group. Okay, so yes, Representative Drew is doing the majority and Representative Woods is doing the minority report. Okay, and the last bill, if I've calculated this correctly, is Senate Bill 252. Representative McGrath.
I'd like to move ought to pass on 252.
And Representative Mazer?
Second.
Representative McGrath, do you wish to speak to your motion?
Sure. I think this is an easy one. Telemedicine is already highly accepted. And by allowing telemedicine to prescribe non-opioids and opioids, the people that this bill will help the most are the incarcerated people. When they're leaving incarceration, it's hard to get a physician, so they can get a telemedicine physician so they can continue the therapy that they've been on when they get out. So that's the main plus for this.
Okay, thank you. Representative Weber.
Thank you. And as I first read the bill, I was very concerned about the fact that one of the things we worked very hard at when we started the discussions about telemedicine and opioids and the more problematical drugs was that we had insisted on that initial inpatient consultation relationship and other things. And as I listened to the testimony that we had, there were two things that really changed my thinking, one of which is we heard from Dr. Ballard that this does comport with DEA standards and is in place in other states. So that was one issue. And the more I thought about it, the more, for me, the risk was less the risks of somebody doing the either the pill shopping or hooking up with a prescriber who is perhaps less scrupulous than most, and more the risk of people not receiving appropriate treatment at a time when they're very vulnerable and needing it. And that goes both for very much for the people who are leaving prison and are sometimes met by dealers at the gate, but also for people who have come to the point in their journey where they think it's time, I need to do something about this, and we need to help them in any way we can. So I think that this, I really changed my thinking about it, and I think that it's a really great step. The other thing, of course, is that we do have the registry where when opioids are prescribed, they have to be reported. All of the prescribers must do that. So if there is a problem going on, there is oversight and appropriate steps can be taken while opening up the access to people who need it. So thank you for the motion.
Okay, anyone else? Oh, Representative Hartnett, sorry.
I'm back.
Okay.
I too will be supporting the bill. Not only will it help people who are leaving correctional settings with medicine and healthcare, but it will also be a great resource for people who have opioid dependence problems, who in particular live in rural areas and might not have access to medication-assisted treatments. So it will have a variety of good, healthy, helpful applications.
Thank you. Anyone else? Representative Woods.
Not a question but a comment. I grew with this bill at my 83 years. I still found that I could learn something, and I indeed did. And practice of medicine since I was in medical school. I won't tell you when, but I'm glad to say
It was only a few years ago.
just a couple years ago. So I too will be able to support this, and this is very much a difference and to how I was trained.
Good. Thank you. Anyone else? Seeing no one else, I'll ask the clerk to call the roll. Motion is ought to pass on Senate Bill 252.
Rep. Mazer?
Yes.
Rep. McLean?
Yes.
Rep. DeLamus?
Yes.
Rep. Cayson? Yes. Rep. Polzhoff?
Yes.
Clerk votes yes. Rep. Corzine?
Yes.
Rep. McGrath?
Yes.
Rep. Kesselring?
Yes.
Rep. Weber?
Yes.
Rep. McKay?
Yes.
Rep. Woods? Rep. Siebert?
Yes. Sorry.
Rep. Tejas?
Yes.
Rep. LaMontagne?
Yes.
Rep. Hartnett?
Yes.
Rep. Lucas?
Yes.
Rep. McDonald?
Yes.
Vote is 18-0. Motion passes.
Okay.
Consent?
Representative Mazer moves consent. Is there any objection? Excellent. Okay. Representative McGrath, you'll write the report on that, please. Okay, I believe we've covered it all with 15 minutes before lunch yet. Again, just to reiterate, if you're able to, and if you're not, that's fine. But if any reports I get today, I'll forward on, and they probably will be in the calendar in time for next week's House session. If you're not able to get to them, then obviously, by this weekend would be wonderful, so that they can be in the week following. Representative Weber, did you have a hand up?
I just wanted to say thank you very much, Mr. Chair, for how you have conducted the committee throughout discussions, both collaborative and somewhat confrontational, but I appreciate the way that everybody on the committee has been treated, and look forward to a productive year again in the fall. And very much glad that we were able to end on that last note, which was a high point.
Absolutely.
So I wanted to thank all of my fellow committee members for the work they do.
Thank you, Representative Weber, and I echo that sentiment. It's been a pleasure working with everyone. Not that we're done yet. We still have the committees of conference, and I'll be reaching out, depending on what we get back from the Senate, to see who might want to serve on those in conjunction with Representative Weber. Again, if you are able to get the reports to me, please remember, if there's an amendment involved, please refer to the amendment. The Deputy Speaker was very insistent on that yesterday, and he's a big guy, and I don't want to mess with him. So with that, unless someone has anything else, I am going to declare us adjourned, and enjoy your lunch.